As we continue to spend time with our families this holiday season, doctors are warning you and your families there's a risk of bringing the nation closer to a possible tridemic. Danielle Miskell spoke with our chief medical contributor about what to be mindful of during holiday gatherings.
This time last year, around the holidays, there was only one large public health concern: COVID.
So if you came in with a fever this time of year last year, we knew what it was.
This year for the holidays, there are three.
So now we're just catching up with everything because everybody's immune system hasn't really seen it. There's almost 3 years of children that had not been exposed to RSV.
Dr. Ryan Stanton says sicknesses kick up after Thanksgiving, and traditionally, the flu season spikes after Christmas. So going into the holiday season, how exactly can one tell if they have the flu, RSV, or COVID, or a combination of the three?
All three can have a fever. All three can have pulmonary manifestations. So the cough and the shortness of breath. Now, what I'm seeing with COVID now is I'm seeing some of the return to some of the more original symptoms, where with a headache is more common. With the flu, what I'm seeing a lot this year is the rapid heart rate, typically in the 120s to 130s, some chest tightness, some shortness of breath, plus minus fever, and of course the muscle aches. And then with RSV, you can actually hear the wheezing with children and shortness of breath and breathing quickly.
Dr. Stanton also says to be mindful of how long the symptoms last. The flu typically lasting days, RSV and COVID weeks.
I've seen a lot of people who have more than one virus at the same time. In fact, and I've seen people that have gotten them in sequence.
With family and friends making more holiday plans, he says if you're sick, to stay home, rest, and treat the symptoms properly, because the biggest concern is it turns into a bacterial superinfection.
Especially after you've started to get better, if you start to get significantly worse again, getting checked out, because sometimes that's a bacterial co-infection, such as pneumonia or one of those others, and those can be very dangerous. In fact, that's one of the most common causes of death with flu. Really, the moral of the story is it's a virus, and you can do what you can do to prevent them. But once you have them, it really is symptomatic management more than anything.
Reporting in Lexington, Danielle Miskell, Fox 56 News.